used to be our chair of the board in AMREF, and many others in the room. Karibuni sana. The discussion around climate change has been there for years. And for those who were with us yesterday in another session, we said the same thing. It's been there in the years. I remember since my childhood, I could hear about global warming, ozone layer, metoboka, those kind of things. But never did it come to close to understand how it relates to our day-to-day living, even our health status and things like that. And we know it has been a global discussion all over, even those who are following up the United Nations General Assembly meeting, that was one of the top discussion there. And also in our regular meetings that we talk nowadays, climate change, especially the effects of climate change, how they impact into health, is not just health, but healthcare and health system. So it is really a subject that we should not shy away from it. It has to be part and parcel in our health discussions. The only challenge has been, this discussion has been held by other climate change experts and lead to where their presence of health agenda. But thank that the discussion keep going on. Even in the COP discussion nowadays, health takes a major platform. And with the Paris Agreement, where countries are making determined contributions, health takes a larger part. The only challenge remains is the resource allocations. So just to give you a big picture, I'd like to show one slide that will speak much on how our continent is really affected. If we can put the next slide, please. Yeah, this borrowed this from the Africa Center for Strategic Studies, and shows it is like it's a picture that came out like 6 or 7 years back. But the things that were discussed there are still happening now. If you go around our continent, and these are few that were able to be picked, you can see there's no part of the continent that is not affected, one, and most of the climate change issues are having direct impact on health. And we can go through the cascades of the climate change effects down to the impact that brings to health. And this picture shows those who are depending on fish as a source of protein to improve nutrition status, they'll be affected. Because fish growth is affected, and affecting half of animal source in the western part of Africa. You can go through each one of them. Maybe I will not have to go through each of them, but you can see when the issue of rainfall, the same applies where we are. Decreased water levels, but also water points, also contaminated water sources. We are reporting cholera, different parts of the continent ourselves. You can see the air, quality of the air is also affected, so you can have a respiratory issue. Again, we are reported recently, I saw an article on Lancet affecting maternal health outcome, particularly neonatal or stillbirth outcome because of the climate issues. And the rising levels of sea levels and the coastal part of where we are in Tanzania as well being reported. You remember the floods that happened around Rufiji, affecting health system structures, bringing climate migrants because people have to move, looking for another location. Affecting our crops, our crops, but also animals where we rely on our source of food. So end of the day, we shall be reporting high rates of malnutrition, high rates of diarrheal cases, respiratory conditions because of the environment we are. Even the extreme heat weathers, whether too cold or too hot, that's the kind of things. So how are we going to cope with this? So I thought we as AMREF have been looking at how things are going on across the globe, but also what's the major issue happening in the continent, but also what is our contribution. And next slide, we just show another directive that we picked from WHO. And I'm glad my director from AFRO is here. Yeah? And this slide is been released by WHO. It's a framework that came out 2015. But how much do we apply it in our programming, in our health programming? This is just a demonstration. It's using the 6 building blocks, health system building blocks. And each of them has an intervention towards what need to do when it comes to health system readiness for curbing the effects of the climate change. And we have challenges along each one of them. Healthcare workers How ready are they? How informed are they? How do we talk to a patient who is facing diarrhea and having cholera in the environment? Do they have source of water? But they're facing drought in their area. There's no source of water. When they fetch the same source of water, the same source where animals feed, they also take shower there, they use the same source of water to make food. Then they need to understand what message they need to take abroad, across the patients as healthcare workers. Leadership, I think this is about how do we prioritize and how do we have climate governance across our programs. Down to the community levels. We have health system structures, yes. We have local government structures, yes. Down to the community, we have village health committees. Are they well informed about climate issues? Do they package? What do they use? Should we promote electricity or should we promote solar at the health facility? Because maybe you're looking at solar as an alternative, but now time has come, solar has to be the main, and the city becomes the alternative source of energy. Climate change, the financing, globally, there's climate green funds, etc. But go and look at that source of funding. What % is being allocated to health? Even the global climate, the green climate fund, I think it's around 0.5 to 6% only to address health issues, while they're most impacted. So you see, these are, if I can go through each one of them, the question remains, and we have more questions than answers. So we as AMREF, we can remove that slide. We as AMREF came up with a strategy that takes us to from 2023 up 2030, where we'll be accounting for the SDGs. And we are very much there on primary health care. And you know that in a primary health care, we address everything, all diseases, talking about communicable diseases, HIV, diarrheal diseases, etc., TB, etc. We're addressing through PHC. Talking about wash intervention, we've been doing through PHC. We've been doing this for many years, but question came that when we put our next strategy, how are we dealing with the effects of climate change? And we ended up having a strategy that has got not just climate change, but even other social determinants of health. And today we are seeing clearly climate change has got greater influence in conditions where we live, we grow, we born, and work. And those are what we call social determinants of health. So climate change has got a bigger stake there. So we have a strategy that has got two major pillars. One of the pillars is a PHC, which we've been doing every day, but we're saying while addressing primary health care, be it non-communicable, communicable disease, wash, whatever, nutrition, we should at the same time address social determinants of health. So we have a second pillar, which is about social determinants of health. So as we are doing our programs, we're also looking on the social determinants of health. So in that area of climate change, we've got two major areas we're looking at. One is on mitigation and adaptation on climate health effects, climate change effects. And another one, we are looking on addressing disease outbreaks. And this is more to do with the surveillance, early detection, and the response. And you realize from this data that I presented there, from WHO report, that out of over 2,000 cases that were reported of outbreaks, over 56% were climate change related. So here we are living that situation. We have to take actions ourselves, but need to ask, actions at what level? It starts from your own level as an individual, goes to your family, to the community that you live with, our government, and each one of us. Climate change, effects of climate change is just there in the next door. It's just with us. We are living with it. How do we live with it? We have a great panelist here who will be telling us about the experiences. And I'm here actually very delighted that we have got a big audience here to listen and contribute. So asanteni sana and welcome to the discussion. Thank you.
Thank you so much, Dr. Florence Tem, for starting this very insightful and exciting conversation on climate change impact. Before I call upon the speakers, I would like to recognize also the presence of development partners, CDC and DOD, the government counterparts, Deputy DPS from Ministry of Health Zanzibar, Director of Health and Nutrition of Services of PRH, Program Manager, NASHCOP, and RIMOs of different regions, Simiu, Shinyanga, non-state actors everywhere. I think the others were already introduced by Dr. Florence previously. We have the presence of the WHO Afro-Regional Director-elect, Dr. Ndungulile here. Thank you so much for taking time to come, and all others. Now I'll start with calling upon our esteemed speakers. I will start with Engineer Colonel Mashala Karma. Is the Deputy Chief of Party of USAID Maji Safi Project. He is a registered professional engineer with over 20 years of experience in civil and public health engineering and program management. He has worked with various international organizations, including World Vision, WaterAid, AMREF, Plan International, and is currently the Deputy Chief of Party of USAID Maji Safi. Kema has extensive field experience across East Africa, leading WASH education, health, and environmental projects. He holds a Master of Science in Tropical Public Health Engineering from University of Leeds and has several leadership, strategic management, resource mobilization, and consultancy roles within Tanzania. Let's put our hands together for Engineer Kama. Karibu sana. Our next speaker is Mr. Darcy Williams, nutrition specialist in early childhood nutrition governance, works with UNICEF Tanzania, is focusing on early childhood nutrition and governance. He has worked in more than 20 countries on programs to improve maternal and child health. He played a key role in developing UNICEF's global food system strategy, with focus on policies that benefit both child and planetary health. Darcy is pursuing a director PhD in epidemiology and population health from LSHTM, I think London School of, and holds an MPP from the University of Cambridge as a Gates Cambridge Scholar. Welcome, and put our hand together to Darcy. Our third one will be Mr. Charles Dismas Mwalimu. Is the head of Vector Control Unit at the Ministry of Health. Charles Mwalimu is an experienced epidemiologist and vector control specialist with over 20 years in vector-borne disease control, holds a Master of Science in Applied Epidemiology from MUHAS, and Master of Science in Biology and Control Disease Vectors from University of London, along with a postgraduate diploma from LSHTM. Currently head of Vector Control at the Ministry of Health and trainer of Vector Control Training Center, Amani Muheza. Expertise includes vector surveillance, prevention and control, implementing indoor residual spraying, insecticide-treated nets, and larva source management programs. Wealth of experience. Let's put our hands together to Mr. Mwalimu. And our fourth speaker is Engineer Mturi James, is our program manager for WASH and climate change, is also leading a portfolio of social determinants of health at AMREF. He's focusing on WASH, public health security, and climate resilience. He has a Bachelor of Science in Environmental Engineering and Masters in Environmental Science. He brings 21 years of experience in building community resilience through climate adaptation and market-based sanitation. He pioneered the solid waste circular economy program, which we are implementing in AMREF, turning biodegradable waste into briquettes for clean cooking, benefiting both climate and livelihood. Previously, he held roles at SNV, WaterAid Tanzania, WWF, GIZ, and the Ministry of Water Tanzania. Let's put our hands together to Engineer Mturi James. So thank you so much, our speakers, for so I will start quickly with getting them into speed. And we'll start with Colonel Mashala Kama. There's poor sanitation and hygiene can increase the risk of climate-sensitive disease outbreaks, and particularly we know the waterborne diseases such as cholera. And the Tanzania HNAP noted, I think you know the HNAP, the planning, the climate change HNAP plan, noted that cholera is one of the most significant climate-sensitive infectious disease in Tanzania, and that weather and climate variability such as El Nino, floods, and etc., we've seen an increase of outbreaks. So can you share your view in our context on the extent of community vulnerability to the climate change-induced extreme weather conditions in terms of access to clean water and optimal sanitation? Karibu, engineer.
Asante sana. A very good morning, everyone. And I'm profoundly honored to have this opportunity. As indicated by the keynote speaker, the climate change really affects broadly. And Tanzania as a country has done a lot. It has tried a lot to improve water and sanitation facilities as to meet the SDGs, especially goal number 6, clean water and sanitation facilities. And as we speak, Tanzania has recorded the access to clean and safe water basic by almost 80% by June this year. While urban coverage is almost 78%. However, with all these efforts, based on the climate change challenges, that's where we see a detrimental impacts in 3 major categories. One is the direct impact, which really affects much of the communities, where you may experience death, physical injuries, among others. But the other key impact is the ecosystems mediated impacts, of which goes with the air pollution, flooding, etc., etc. And lastly is the social mediated impact, which goes up with the migration of people. And most of the people who are affected, women, children at large. So even the systems infrastructure that already has been developed, the country has made efforts to reach this proportional percentage of access to basic water supply services, sanitation services, becomes more or less not useful at the end of the day. And that's where we experience outbreaks of cholera and other diseases. We saw this a year ago in Manyara, Hanang, how the impact really affected. That was an outcome of the climate change. We saw almost 2 years ago in Dar es Salaam, where the city was short of water supply services because of the impact of the climate change within the Wami Ruvu Basin Water Board. So as a country, Tanzania is divided into 9 basin water boards. And majorly the Wami Ruvu Basin, which has almost 11 regions across the country. So what role this basin water boards does? They are supposed to share data that are being generated from time to time from the rivers, from the dams that they manage, so that this data can provide sufficient information to the systems to be able to acquire and plan effectively. As we speak, through the Ministry of Water, have developed something which is called operational decision system, support system, ODSS. This is a system that enables to enhance gathering of information from various basin water boards in relation to the climate change. And this helps really to facilitate and track the effects of the climate change within the respective areas, whereby they can be shared to the planners to effect the smooth uptake of the designs of the planning, among other issues. So if we are to address the challenge of outbreak, including cholera, as among of the key gaps which are really affecting the country, and as we speak also, Madam Moderator, the country across all the regions are hit by cholera. And mostly the Lake Zone, Mwanza and the Simiu among the top regions which are being affected by cholera. But why this? I think the major key gap is the information and the systems in terms of planning, in terms of coordination, and in terms of where do we start the planning. That's where the gap is. So to strengthen the primary health care into perspective of climate change, the information sharing has to trickle down to the beneficiaries at large. Thank you.
Thank you so much. So what's your opinion in terms of building adaptation to climate change? I know you started like sharing that, the information, sharing of the information, trickle down on information, maybe translating the weather information which is shared. So what's your opinion in terms of making the community resilience with water, sanitation, and hygiene? Just
Thank you, Madam Moderator. I think at the present we depend most on the Tanzania Meteorological Agency as the primary source of information on the weather or related like. However, as I said, we have the basin water boards, 9 basin water boards across the country, of which they are the ones really close to the communities, whereby I feel they are not really sharing the messages or the information that the data they generate for enabling the systems at the district level, at the regional level, to have a thorough planning. That's the gap. So if we are able to strengthen this aspect of data information sharing to be adapted to the healthcare committees at village level, at ward level, so they are able to internalize and integrate of what they think is
Engineer Karma, and now I would like to have to get some insights from Mr. Darcy Williams. As a consequence of climate change, we have experienced increased frequency and intensity of droughts and foods with negative impact on food crops, livestock, leading to food insecurity, and increase in burden of undernutrition, which mostly affecting women and children, of course, especially in rural areas and the areas which we have already discussed previously that are intensely affected by. So in your capacity as your nutrition specialist at UNICEF, so what is your opinion or experience on the scale of climate change impact on food security and burden of undernutrition among climate change affected communities, specifically here in Tanzania in our context?
Asante sana, Dr. Muya. Tanzania oye! Tanzania oye! Habari za leo. Okay, safi sana. First of all, asante sana to AMREF for organizing this and our esteemed guests today. It's a pleasure to join you and all of the great speakers on the stage. So from my perspective, it's quite clear the relationship between nutrition and the climate crisis is a bidirectional relationship. That's why UNICEF, we've been calling it the climate crisis is a nutrition crisis. Of course, you've also heard the same thing in every sector. Climate crisis is a wash crisis, is an education crisis. It's because it affects multi-sectorally. I might be a little bit more biased because I'm a nutritionist, but from my perspective, it's this bi-directional relationship between child nutrition and the climate crisis, which offers unique challenges, but also some unique opportunities. So we know that this bi-directional relationship is driven by a failing food system that's not only contributing to more than 30% of global greenhouse emissions, but the same food system is driving a triple burden of malnutrition in many countries around the world, and Tanzania included. So what do I mean when I say triple burden? I mean undernutrition, which includes stunting and wasting. I mean micronutrient deficiencies, which is hidden hunger. And I also mean childhood overweight and obesity, and we'll get to that. So within those three, for undernutrition, you see it's kind of the classic relationship you have seen. The climate disasters are causing huge shortages in the quantity of food, which is throwing many children and many families around the world, including in Tanzania, into food insecure situations, and also driving them into severe child food poverty, which UNICEF defines as children consuming less than 2 food groups a day. And globally, 200 million children under 5 are living in severe food poverty, and that is highly associated with regions that are also at greatest at risk for climate. Those same climate shocks are also causing huge disruptions in child food practices. So with a disproportionate burden placed on women, a lot of the caring and feeding practices are quite difficult. And then also we know, as my colleague just mentioned, the effect on clean drinking water, which results in disease and then also results in severe acute malnutrition. Now for micronutrient deficiencies, the problem is a little bit more hidden, which is why we call it hidden hunger. Not only are we worried about the quantity of the food going down, so the number of staples, wheat, rice, maize, and also nutrient-dense foods like fruits, vegetables, legumes, but we're worried about the micronutrient quality of that food dropping. So we know there's an association with higher CO2 in the atmosphere and lower rates of important micronutrients like zinc, iron, and vitamin A. And for example, some studies have come out that have shown with rising CO2 levels, you have about 175 million more people globally at risk of zinc deficiency. And even worse, you have 1 billion women at risk of more women at risk of anemia because of a complete decrease in iron from their daily diets. Now for overweight obesity, this is the area some people don't really know how it's connected, but the childhood overweight obesity crisis around the world, which is here and coming in Tanzania, is driven by the production, marketing, and consumption of ultra-processed foods. Those same foods and the companies that produce those same foods are also driving environmental degradation. And those foods are connected to greenhouse gas emissions, biodiversity loss, pesticide pollutions, plastic packaging pollution. So you can see across all the 3 forms of malnutrition, there's a direct correlation with nutrition and climate, and the scale is incredible globally and also here in Tanzania.
Wow, thank you so much. That's a very good, insightful discussion. And so when it comes to sustaining child nutrition in regions that are severely impacted, what's UNICEF's main priorities? And what about mitigation efforts that you do to protect children in the long run?
Thanks, Asante Sana, Dr. Buya. So that bidirectional relationship I mentioned, while it's challenging, it also offers an opportunity. If you can work through the food system, you can both adapt to the climate crisis to protect child nutrition today, but you can also then mitigate, because we can't just focus on today, because that was the problem. That's why we're here today, is because we only focused on today and we weren't focusing on the future. We also have to make sure our interventions with nutrition and agriculture mitigate child malnutrition today and climate crisis in the future. So in terms of adaptation to sustain child nutrition today, you have the classic agriculture interventions. And in Tanzania, the government's leading a lot of innovation when it comes to climate smart techniques. We have improved forms of agroforestry, improved seed varieties. We have improved innovations with rainwater harvesting. I think I'm relatively new to Tanzania, but I think I've heard correctly that the government is piloting some interesting programming in Arusha in the drylands called Chololo pits, where They're working with smallholder farmers to dig pits in the ground during the dry season. When the rain comes, they fill those pits with fertilizer, and then those smallholder farmers have a little bit more moisture to work with than they would usually, and they can produce more during the dry periods. Now, from a UNICEF nutrition perspective, our nutrition programming looks to amplify those agriculture interventions. So we look to strengthen community systems so that community resilience builds to eventually deliver nutritious diets, services, and practices for children and family. So our 4 key priority areas for adaptation, the first is improving child diets through public policy. So that's working on the pipeline of therapeutic foods, fortified foods, supplementation. That's also improving child services, both in health facilities and with community health workers. So breastfeeding, also micronutrient supplementation. 3 is working on practices, which is, supporting positive individual behavior, but also positive gender and social norms. And then the 4th priority action is integrating the early detection and treatment of wasting in all programs and services. Now, on the mitigation side of things, we also want to figure out, okay, how do we prevent all forms of malnutrition today? So undernutrition, micronutrient deficiencies, overweight, obesity, while also preventing further environmental degradation. So again, we have 4 priority actions. The first is to improve child diets. And the number 1 intervention here we like to focus on, if you're thinking of UNICEF and nutrition, what is the first intervention that comes to your mind? Of all of them. What is UNICEF known for? Anyone?
Anyone wants to put their hand up?
If you were to think of UNICEF and nutrition and first 6 months of life, what intervention are you going to think of first? Breastfeeding. Bingo. Breastfeeding is the most pro-climate, green, carbon-neutral intervention for child nutrition while simultaneously disrupting the global supply chain of baby formula, which is disastrous for the environment, with their use of water, their plastic packaging. And so that's key and something we've been doing for years. 2 is to use fiscal measures so that simultaneously you make sustainable, low-carbon, and nutritious diets affordable and accessible to every child and family. 3 is the standards and regulations around schools. So that means making sure that schools can, in and around schools, you can access low carbon, sustainable, and nutritious diets, especially fortified foods. And then the last one is my favorite, which is food environment policies. So these are food environment policies that reduce the consumption of ultra-processed foods, which is also reducing the risk of childhood overweight obesity. But at the same time, those same policies have an environmental positive effect because you're reducing the consumption of these products that are produced by these companies that are destroying our environment. And so those are examples of restricting the marketing of junk food to kids, but also front-of-pack nutrition labeling, which we're working on with the government in Tanzania. So from our perspective, we have to think about adaptation and mitigation, and then we'll set ourselves up for a better future. Thanks.
Great. Thank you so much. That was a very, very good conversation, and thank you so much for that. And I will just now jump to Mr. Dismas. So climate-sensitive vector-borne disease has been associated with either directly or indirectly with global climate change globally. I think that's a big discussion around that nowadays. And for example, a number of climate-associated vector-borne disease epidemics, including malaria, dengue fever. Specifically, those are the ones actually affecting our communities. And there's been reported in various new geographical locations where there was low prevalence of malaria. Now malaria is on a rise. So what can you tell us regarding the extent of which climate change is affecting geographical spread and seasonability of vector-borne diseases like malaria and dengue fever, specifically here in Tanzania?
Yeah, so thank you so much for that nice question. Yeah, first of all, I'd like to mention some of the few vector-borne diseases which has been occurred in Tanzania. And when we are talking about vector-borne diseases, we are talking about diseases that are transmitted by vector. And here we speak about mosquito and some other flies. But specifically for malaria, I'm sure you all know that malaria is transmitted by mosquito. And these mosquitoes are called the Anopheles. And the dengue fever are transmitted by mosquito called the Aedes mosquito. So all these mosquitoes, in order to breed, they need the optimal range of temperature, but also they need the optimal range of rainfall. So there is a direct association between vector-borne diseases and climate change. For mosquito, in order to breed, they require optimal range of temperature, and this is why we say malaria has a direct association with the climate change. But also, you know, mosquito breed in water, particularly stagnant water. And in order to have water, we need to have rainfall. So you will all know that during rainfall, we experience a lot of cases of malaria. And this is because there's a plenty breeding site for mosquito. There are a range of mosquito, like Anopheles mosquito, they breed in clean water exposed to direct sunlight. But the Culicine mosquito, they breed in polluted water, but all they need water. So during the rainfall, we experience a lot of breeding sites. And just after rainfall chase, there is where we start to experience mosquito breeding and cases of malaria. But you all know that during the rainfall, when there are stagnant water, rainfall tends to wash the breeding site. So heavy rainfall has also an impact on the control of breeding site because they flush the breeding site. Mosquito require a stagnant water. If water is moving, mosquito cannot breed. But talking about the temperature, there is optimal range of temperature which are required for mosquito to develop from immature stage to adult. And the required ambient temperature is ranging from 21 centigrade or 25 to 27 centigrade. This is the optimal range of temperature which is required by mosquito to breed. So at the very low temperature, mosquito cannot breed. That's why there is, again, a very strong association between temperature and malaria. I'm sure you have seen the malaria stratification map. At the corridor, at the middle of the corridor of Tanzania, malaria is very, very low, and you can all appreciate that. And this is, apart from the intervention which we are taking along those areas, but also the low malaria is because of the low temperature. Because mosquito needed to live at least like 28 days at optimal range of temperature. So for the malaria parasite to complete their cycle in the mosquito body, in the gut of mosquito, they require optimal range of temperature. If the temperature is very, very low, malaria parasite cannot complete their life cycle in the body of mosquito. And I said, in order a person to get malaria, he needs to be bitten by mosquito. And these are the mosquito which have the parasite. So the parasite need a certain range of temperature to complete their development in the body of mosquito. So there is a very strong association between temperature, rainfall, and malaria. But again, there is another dimension of climate change, which is humidity. And by humidity, this is the amount of moisture content in the air. So the activity of mosquito is also influenced by relative humidity. If the air is contain a maximum range of moisture content, the activities of mosquito become very active. And survivorship of mosquito is influenced by relative humidity. So this is another dimension of climate change which influence malaria and dengue transmission. But again, drought, as has been said by others on the issue of cholera and nutrition, but again for malaria, drought has an effect on the transmission of malaria. And That's why we find some areas have a seasonal malaria transmission, and this is because those areas are so dry, and in some places there are pools of breeding sites, and those they act as a source of mosquito breeding site. So to emphasize here, there is a very strong association between climate change, temperature, rainfall, and the transmission of vector-borne diseases. Thank you.
Thank you so much. Yeah. And just a follow-on question. What can community-based health intervention play to mitigate the increased transmission of vector-borne diseases due to climate change?
So thank you so much again for that questions. As I said, mosquito breeding in a stagnant water. And if we have a pool of stagnant water, those are places where mosquito can breed. So there is a role which community can play to make sure that they distract the breeding site. Because if you distract the stagnant water, mosquito can no longer breed. So community engagement and involvement in the environmental sanitation and source reduction is very, very important. And this is the key. Because, you know, we also use some insecticide, but the insecticide are last resort. You use The second intervention is community education and promotion. We need to impact the community with the right practice, right knowledge to make sure that they know the best practice to tackle malaria prevention and mosquito prevention. Because, you know, mosquito, they breed, as I said, in the stagnant water, and these stagnant water are within the community. So we need to give the community education to know where mosquito they breed, and to take the initiative to make sure that they distract the breeding site. But another dimension is the house improvement. There is a very strong association between poor housing and the malaria transmission. So if community, they improve their house, making sure that they put mosquito screening, they will reduce exposure to mosquito bites. So this issue which communities can play a role to make sure that they prevent malaria. But another, but not least, is the community-wide use of preventive measures. You know, as a government, we are providing mosquito net, and this mosquito net are given free of charge to the community. So in order mosquito to give protection to the community, we need the community must use the net. So if of exposure to malaria vector. So these are the key things that the community can play to make sure that they distract the mosquito breeding. But another issue is habitat avoidance. Because there's a tendency of community to construct houses in a marshland, areas which are potentially for mosquito breeding. If the community, they can stay away from vicinity to the breeding site, they will reduce the risk of mosquito bite. So that is what I can say, and thank you so much.
Thank you so much. So communities can reduce breeding areas, potential breeding areas for mosquitoes. I think that's something that people can do. So I'll now jump to our last speaker, Engineer Mturi James from AMREF. So in recent years, Tanzania experienced natural disasters involving extreme rainfall leading to floods and landslides, which have been attributed to effect of climate change. So as the government continues to implementing disaster response efforts nationwide, key stakeholders, including AMREF, committed to support effective disaster management and response strategies in the country. So what can you share with us about AMREF's role in supporting the adaptive response in some communities affected by, for example, the landslide in Hanang district in Manyara and extreme floods which happened in Rufiji, Pwani region. Karibu.
Yeah, thank you, moderator. Good afternoon. Thank you very much again for a very good discussion and for the question that has been posed on me. Is that we all know that we have already have a climate crisis. All the speakers have mentioned the crisis that we have from the ecosystem good and service provision, from the water resources, food service, but also on the health impact. So we are struggling with today's climate vulnerabilities as we all feeling right now, but we are also struggling with tomorrow's climate change. Today, climate vulnerability, I mean when we see the weather change pattern as of now. But when you count in a long-term pattern for 50, 100, and whatever, that's when we say climate change. So the climate change is heavily brought by the change of extreme weather events that lead to failure of ecosystem good and service provision. We have been seeing the number of social determinants that are affecting heavily